Your legs may already know a stroke is coming, long before your head feels anything wrong, and they're trying to warn you now. One ignored sensation, one silent change below your waist, could decide whether this story ends in survival or tragedy. Welcome to Wellness Unfolds, where we uncover the hidden secrets of your body and guide you toward a healthier, longer life. Did you know your legs might be whispering warnings about a danger silently approaching your brain right at this very moment? We often ignore subtle signs, but understanding the link between your legs and brain could save you from a severe stroke. Stroke remains a leading cause of disability worldwide, yet many of these tragic events are preceded by clear, observable warning signals. Today, we specifically address women over 60, as your bodies often present symptoms that are easily dismissed as just getting older. Your circulatory system is a unified network, meaning problems in your lower extremities often reflect the condition of vessels in your brain. Medical experts call the legs a mirror of cardiovascular health, revealing hidden truths about the state of your arteries and veins. By paying attention to these 10 specific signs, you can catch potential threats early and take action before a crisis occurs. We have categorized these 10 critical signs into 3 main groups: sensory changes, circulation issues, and the danger of blood clots. Stay with us until the very end, as recognizing just one of these symptoms could be the key to saving a life. Let us first understand the biology behind why your legs are so intimately connected to the health of your brain vessels. Peripheral artery disease, or PAD, occurs when plaque builds up in the arteries of your legs, restricting essential blood flow. If you have plaque buildup in your legs, it is highly likely you also have similar blockages in your carotid arteries. This systemic atherosclerosis means your entire vascular highway is compromised, significantly increasing the risk of an ischemic stroke in the brain. Therefore, symptoms in the legs are not isolated events, but rather systemic alarms that the entire vascular network is under stress. Let us begin with the first group of warning signs, which involves sudden changes in sensation and your ability to move. Sign number 1 is sudden unilateral leg weakness, where one leg feels surprisingly heavy or simply refuses to support your weight. This happens when the motor cortex in your brain is not receiving enough oxygen, failing to send proper signals to muscles. Unlike general fatigue from exercise, this weakness strikes instantly and usually affects only one side of the body, a classic stroke sign. If you ever experience this sudden collapse or inability to move a leg, you must seek emergency medical attention immediately. Sign number 2 is numbness or a tingling sensation, often described by patients as pins and needles running down the leg. While this can happen if you sit awkwardly, persistent numbness without a cause indicates a disruption in the brain's sensory pathways. This sensory loss suggests that the part of your brain responsible for feeling the leg is being deprived of blood flow. Pay close attention if this numbness spreads rapidly or is accompanied by confusion, dizziness, or difficulty speaking clearly to others. Sign number 3 is a condition known as foot drop, where you find it difficult to lift the front part of your foot. You might find yourself dragging your toes while walking, or having to lift your knee higher than usual to avoid tripping. While sometimes caused by nerve damage in the knee, sudden foot drop can actually stem from a stroke or a brain tumor. This loss of motor control is a specific neurological deficit that requires a doctor to rule out central nervous system causes. Do not assume this is just an orthopedic issue. If it happens suddenly, treat it as a potential neurological emergency. We now move to the second group of signs, which relate directly to the efficiency of blood circulation in your lower limbs. Sign number 4 is unusually cold feet, specifically when one foot feels significantly colder to the touch than the other one. Chronic cold feet might be common, but a sudden temperature drop in one leg indicates a blockage in a major artery. This lack of warm blood reaching the extremities is a strong indicator of peripheral artery disease and systemic vascular problems. When your legs are cold due to poor flow, your brain vessels are likely suffering from similar restrictions and reduced oxygen. Checking for pulse in the feet is a simple test doctors use to gauge the overall health of your arterial system. Sign number 5 involves visible changes in skin color, ranging from unnatural paleness to a concerning bluish or purplish tint. Pale skin suggests arterial blockage preventing blood arrival, while a blue tint indicates deoxygenated blood is trapped and not returning. These color shifts are visible warnings that your tissues are starving for oxygen, a condition that might be happening in your brain. If you notice your legs turning white when elevated and red when lowered, consult a vascular specialist as soon as possible. Healthy circulation maintains a consistent skin tone. Any deviation is a sign that the transport system of your body is failing. Sign number 6 is a specific type of pain known as claudication, which feels like a cramp when you are active. This pain typically starts when you walk a certain distance and completely disappears after you rest for a few minutes. It occurs because your muscles need more blood during exercise, but clogged arteries cannot deliver it, causing a painful ischemic reaction. Think of this as angina for your legs. It is the same mechanism that causes chest pain when the heart lacks oxygen. People with claudication have a significantly higher risk of suffering a stroke or heart attack within the next few years. Do not dismiss this as just old age or arthritis. It is a vascular scream for help that requires medical intervention. Sign number 7 is the presence of sores or ulcers on your feet or legs that are extremely slow to heal. Blood carries the nutrients and oxygen needed for tissue repair. Without good flow, even a tiny scratch can become dangerous. These ulcers are often painless initially, but can lead to severe infection and gangrene if circulation is not restored quickly. This sign is particularly critical for diabetic patients, who are already at a heightened risk for both stroke and amputation. The presence of these non-healing wounds confirms that your vascular system is severely compromised, putting your brain at high risk. Sign number 8 might seem cosmetic, but is medically significant: loss of hair on your legs or slow-growing toenails. Your body is smart. When blood flow is limited, it prioritizes vital organs and stops supplying nutrients to hair and nails. If you notice your legs are suddenly hairless or your toenails are brittle and not growing, take it as a warning. Shiny, hairless skin on the lower legs is a classic clinical sign of peripheral arterial disease that doctors look for. We now arrive at the third and perhaps most immediately dangerous group of signs related to the formation of blood clots. Sign number 9 is sudden swelling in just one leg, often accompanied by redness, warmth, and tenderness to the touch. This is the hallmark symptom of deep vein thrombosis, or DVT, where a dangerous clot forms deep within your leg veins. Unlike swelling from salty food, which affects both legs, DVT usually strikes only one side and is a medical emergency. The real danger lies in the clot breaking loose and traveling to your lungs, or in some cases, reaching the brain. Sign number 10 is a deep, throbbing pain in the calf that feels like a heavy cramp but does not go away. This pain often worsens when you bend your foot upward towards your knee, a diagnostic check known as the Homan's sign. Crucial warning: if you suspect a clot, never massage the leg, as this could dislodge the clot and cause a stroke. Recognizing these 10 signs is the first step, but understanding the concept of a warning stroke is equally vital for survival. Let us discuss the transient ischemic attack, or TIA, often called a mini-stroke, which serves as nature's final warning shot. A TIA happens when blood flow to the brain is blocked for a short time, causing stroke-like symptoms that disappear quickly. Because the symptoms resolve within minutes or hours, many people make the fatal mistake of ignoring them and going to bed. Statistics show that a significant number of people who have a TIA will suffer a major, disabling stroke within 48 hours. Think of a TIA not as a lucky escape, but as an immediate emergency that requires the same urgency as a full stroke. If you experience temporary leg weakness or numbness, call emergency services even if you feel completely normal 10 minutes later. Now that we are armed with knowledge about the warning signs, let us focus on the power of prevention and lifestyle changes. The most critical factor to control is high blood pressure, the silent force that damages your arteries over many years. Keep your blood pressure in a healthy range through medication if prescribed, and regular monitoring at home is absolutely essential. Adopt a diet rich in fruits, vegetables, and omega-3 fatty acids, which help to reduce inflammation and keep arteries flexible. Regular physical activity, such as brisk walking for 30 minutes a day, acts as a natural medicine for your circulatory system. If you smoke, quitting is the single most effective step you can take to immediately lower your risk of stroke. Staying hydrated is simple yet powerful. Water helps maintain blood volume and prevents it from becoming too thick and prone to clotting. Avoid sitting for prolonged periods. Simple ankle rotations and leg lifts while watching TV can significantly improve your venous return. For those with diabetes, managing your blood sugar levels is non-negotiable, as high glucose destroys blood vessels throughout the body. Chronic stress elevates cortisol and blood pressure, so finding time for relaxation and mental peace is vital for stroke prevention. Your health is a treasure not just for you, but for the loved ones who cherish your presence in their lives. Remember the three groups: sensation changes like weakness, circulation issues like coldness, and clotting signs like swelling and deep pain. Knowledge is your best defense. Listen to your body's whispers so you do not have to hear its screams. Regular checkups allow your doctor to listen to your arteries and detect problems long before you feel any symptoms. Be an advocate for your own health. If something feels wrong with your legs, insist on a thorough vascular examination. Every step you take towards a healthier lifestyle is a step away from the risk of stroke and disability. It is never too late to start. Small changes today can compound into years of healthy, active life in the future. Nourish your body, respect its signals, and treat it with the care it deserves for serving you all these years. If you found this information vital, please share this video with the women in your life who need to see it. Thank you for watching Wellness Unfolds. Please subscribe for more vital health insights and take care of your precious health today. Let us dig a bit deeper into the nature of the plaque that clogs arteries, often made of fat and calcium. Over decades, this plaque hardens, turning your flexible arteries into stiff pipes that cannot expand to accommodate blood flow changes. The most dangerous plaques are unstable ones with thin caps that can rupture suddenly, triggering an immediate clot formation. High levels of LDL cholesterol are the primary architects of these blockages, depositing fat into the vessel walls year after year. Knowing your lipid profile is essential. Keep your bad cholesterol low and your good cholesterol high to protect your leg arteries. Another silent culprit is atrial fibrillation, an irregular heartbeat that allows blood to pool and clot before traveling to the legs. If you have palpitations or an irregular pulse, your risk of throwing a clot to your brain or legs increases fivefold. Modern technology like smartwatches can help detect these irregularities, providing an early warning system for potential stroke risks. Quality sleep is when your vascular system repairs itself. Chronic sleep deprivation keeps your stress hormones and blood pressure dangerously high. Sleep apnea is a major risk factor. The drops in oxygen levels during the night place immense strain on your cardiovascular system. Excessive alcohol intake raises blood pressure and can weaken the heart muscle, making it harder to pump blood to your legs. Carrying excess weight forces your heart to work harder and puts physical pressure on the veins in your legs, hindering circulation. Even a modest weight loss can significantly improve blood flow and reduce the burden on your heart and vascular system. Omega-3 fatty acids are natural blood thinners and anti-inflammatories that help prevent the plaque buildup we discussed earlier. Ensure your diet is rich in magnesium and potassium to prevent leg cramps and help regulate your blood pressure naturally. Hidden sugars in processed foods spike your insulin, leading to inflammation that damages the delicate inner lining of your blood vessels. In colder months, keep your legs warm to prevent vasoconstriction, which can further restrict blood flow in already compromised arteries. If you do not have blood clots, gentle daily massage can help stimulate blood flow and relieve the sensation of heavy legs. Simple heel raises while standing in the kitchen act as a pump, forcing venous blood back up towards your heart. When resting, elevate your legs above heart level to let gravity assist your veins in draining blood back from the extremities. Remember the phrase, time is brain. For every minute a stroke goes untreated, millions of brain cells die permanently. Combine your knowledge of leg symptoms with the FAST rule: face drooping, arm weakness, speech difficulty, time to call emergency. Set up your medical ID on your phone so first responders know your medical history and contacts if you cannot speak. Never stop taking prescribed blood thinners or blood pressure medication without consulting your doctor, as rebound effects can be deadly. Many women have saved their own lives simply by noticing a cold foot or a persistent cramp and seeking help early. Surround yourself with a community that values health. Social isolation is a risk factor, while connection promotes mental and physical well-being. Ask your doctor about a Doppler ultrasound screening for your legs. It is painless, non-invasive, and reveals blockages clearly. The ankle brachial index is a quick test comparing blood pressure in your arm and leg to diagnose peripheral artery disease. While internet research is helpful, do not rely on self-diagnosis. These symptoms can mimic other conditions and need professional evaluation. Do not let fear of finding something wrong keep you from the doctor. Early detection turns a crisis into a manageable condition. Surprisingly, poor oral health is linked to cardiovascular disease. Bacteria from gum infections can enter your bloodstream and damage vessels. Maintain good oral hygiene as part of your stroke prevention strategy. Brushing and flossing to keep inflammation out of your body. Monitor your caffeine intake. While a cup of coffee is fine, excessive stimulants can trigger heart palpitations and raise blood pressure. Discuss supplements like vitamin D and CoQ10 with your doctor, as they can support heart and muscle health in older adults. Aim for a stable, healthy weight rather than extreme dieting, which can stress your heart and mess with your metabolism. If you are diabetic, inspect your feet every single evening for cuts or blisters that you might not have felt. Wear comfortable, properly fitted shoes that do not constrict your feet, allowing blood to circulate freely throughout the day. Avoid crossing your legs for long periods, as this acts like a tourniquet, restricting blood flow and increasing clot risk. Practice deep breathing exercises to fully oxygenate your blood, ensuring that every beat of your heart delivers maximum nutrition. While our vessels naturally stiffen with age, accelerated damage and blockage are not inevitable and can be prevented with care. If you are a caregiver, watch how your loved one walks. A change in gait is often the first sign of trouble. Never dismiss complaints of leg pain or numbness as just aging. Investigate them thoroughly to rule out vascular causes. Your legs are truly a window into your cardiovascular health, offering visible clues to invisible problems lurking within your arteries. By taking care of your legs, you are literally standing up for your brain health and your future independence. Maintain a positive outlook. A hopeful mind reduces stress hormones and creates a healing environment for your entire body. Let's review one last time. Sudden weakness or numbness in the leg is a neurological emergency demanding immediate action. Dragging your foot or feeling unnatural coldness in one leg suggests that nerve signals or blood flow are blocked. Skin turning blue or pale and cramping pain that stops you from walking are cries for oxygen from your tissues. Sores that will not heal and hair loss on the shins indicate chronic poor circulation that puts your brain at risk. Sudden swelling and deep throbbing pain in one leg are red alerts for a blood clot that could travel upwards. Memorize these signs, not to live in fear, but to live with the confidence that you are prepared and protected. Your golden years should be filled with joy and activity, not shadowed by preventable health crises. Make it a habit to check in with your body daily. You are the best expert on how you feel. By watching this video, you have taken a significant step towards safeguarding your future and the future of your family. Wellness Unfolds is dedicated to bringing you the most accurate, life-saving health information in a way that is easy to understand. We invite you to explore our other videos on heart health and stroke prevention to build a complete picture of wellness. Thank you for trusting us with your time and attention. We do not take your support or your health for granted. May your steps remain strong, your mind remain clear, and your life be filled with vibrant health and endless happiness. Please remember this content is for educational purposes. Always consult your personal physician for medical advice specific to your condition. Thank you for watching Wellness Unfolds. Please subscribe for more vital health insights and take care of your precious health today.